Welcome, everybody. I'm Dr. Fawad Taj. I'm one of the past presidents of our chapter here in Northeast Ohio. We work under the banner of UPNA. We're one of the 32 chapters of UPNA. And from time to time, we've been doing these webinars to help not only the local medical students, but medical students across U.S. and international medical graduates. This has been a team effort. I'm very thankful to Dr. Shahzad Raza, Dr. Faiz Anwar, and Dr. Ahmed Safdar and Dr. Kainat Waraij to volunteer and come up with this webinar to give us some information. So just basic ground rules, please keep yourself muted during the presentation. We'll have about 15-20 minute presentation by our presenters. We'll take questions in the end. If you have any questions, please put them in the chat and we will read them out. Try to focus your questions on the topic that we're covering today. This is only part one of our three-part series. And then we will try to get to most of the questions that you put through in the chat. So as the question come up, go ahead and put it in the chat and we'll go through it through those questions in the end. So with that, I'll hand it over to Dr. Anwar. Thank you. Dr. Anwar, you're muted.
Okay, thank you. I got the permission to unmute myself. Thank you. Assalamu alaikum again. I just have 3 slides to share with you guys, and I will have our speakers run the show. Let me shorten this one. Nope, I want to show this slide. So the whole idea is, we want to give you some tips on how to build a life for success and service. And in the backdrop of the residency, I just want to make one observation on this slide that now in the USA every year, more than 40,000 residents are entering into the training. A vast majority of these residents are US MDs and DOs, but IMG also play a very significant role. And if you look at in the 2025, and the level of competition for IMGs, it's roughly 60% of the people are matching. So in my mind, this is 1 in 2 chance of applying and matching into your residency of your choice. And here is my slide. I'll just spend a minute on this slide and I'll let you guys take over. So when I interview a resident, when I interview a fellow, when I interview a faculty, what are the criteria we use as a faculty, which is assessing a candidate? There is no fixed rule. Each job, each scenario may have different criteria. But in general, if I look at the 10-point agenda, how we assess anybody on a professional level, so we look at their medical training, how well-known and reputable their school was, did this candidate graduated at the top 10% of the class or not? What are their unique clinical and curriculum strengths? That may be more important for faculty if there's a faculty well suited for the job. So that may be more important. Similarly, it can be applicable to residents and fellows. And then for internship, scores important. There are many programs now use score cutoff criteria, year of graduation as another criteria. And there are some red flags, so to speak, low scores, multiple attempts, so try to avoid that. If you have those red flags, recognize that and work hard to overcome those deficiencies. And on top of that, clinical experience, especially US clinical experience is important for IMGs. And then in general, if you have a teaching, love for teaching profile, that indicates your leadership, your academic love, your confidence. Similarly, your profile can be strengthened with scholarly activities and publications. Volunteer work is equally important. It shows that you care about your community, you care about the people around you, you're a well-rounded individual, you're compassionate. Similarly, your hobbies, your sports are equally important. It is possible your entire interview can be done just on your passion, your pastime, and your hobbies. Communication skills are important, and I did not grow up in this country, so we do not want to hire a candidate where patients and families have difficulty understanding and communicating with them. So that's why communication skill for a physician is very important. And we want to hire somebody who is a colleague, who's a team player and a good fit for the program. And along these tracks, that's where we're looking for leadership in any format. So, if you can take a picture of this slide and see how you want to score. On the right side, I'm just saying that, range of scoring each category should be 1 to 7. And if the maximum score is, in this case, 70, you can score yourself based on this and try to improve on that. Thank you. So I'm not sure who is going first. Maybe I will have Ahmed Saftar go first at this point, and I'll stop sharing my slides. So Ahmed, you are mute. I think our host have to give you permission to unmute yourself.
Okay, Assalamu alaikum everyone. My name's Ahmad. Let me just pull up my presentation and we'll get started. All right, can everyone see my slides?
Yes, we can see them.
Okay. All right, so thank you, Dr. Anwar, Dr. Taj, and Dr. Raza for allowing me to speak today. I do want to preface by saying I am a USMD, so I am not an IMG, and so my experience may be a little different. Nonetheless, I've tried to structure my presentation and make it valuable to everyone. So I have a lot of friends in my programs who are IMGs, and so I've asked them questions and kind of incorporated what they said into my presentation. So a little bit about me. I grew up in Arizona, so I was actually born the day my mom landed in the US. So I just made the blue passport. But I went to undergrad and medical school in Arizona at the U of A. And then when I was looking for programs for residency, I knew I wanted a few things. One, I wanted to leave Arizona to kind of expose myself to a different healthcare system. Number two, I wanted an academic place, and the reason being I had interest for research, and also I'm interested in cardiology, and I wanted to go to a place that would expose me to sick cardiac patients. And the most important reason was actually because of Dr. Anwar. He lived in Arizona before, and so since middle school, he's been mentoring me. And he moved to the Cleveland Clinic. And so, after talking to him and with his encouragement, I thought, the Cleveland Clinic would be the best place. So my presentation is going to be geared around your CV and also your personal statement. So what should your contents be in your CV? Starting at the top, medical school, that's the first thing that every program will look at. Now, there's certain important parts of, the medical school. One, is it a well-known medical school? So if you go to, for example, Harvard Medical School, you're going to be looked at differently than if you went to the University of Arizona. And similarly, if you went to Aga Khan, for example, they will look at it differently than a less well-known medical school. The reason is because of this. When your medical school sends your performance evaluations, if it's from a school that they're familiar with, they know a little bit about how the students are evaluated and they've seen examples of good MSPEs. But when it's a medical school they're not familiar with, they don't know what the standardization is, they don't know what the average student is like. And so it gets a little complicated for them to figure out, who should we, how do we assess, he's the top 1% in this program compared to another program. With medical school, you'll throw in, your awards and recognitions. And then some medical schools in the US, and I know a lot of the international medical schools display, what your rank is in the class. And that's a good thing for the programs to see, among all your class, where did you stand? Now, clinical work is very important, especially for IMGs. All my friends who matched at the Cleveland Clinic who are IMGs did away rotations at different hospitals. And so doing a sub-internship where you actually have access to the EMR is much more beneficial for you than, just doing an observership. Nonetheless, like observerships are okay, and they allow you to kind of expose yourself to what the US system is like. I want to talk a little bit about observerships and, being a resident. I've worked for 2 years with observers from Pakistan, from India, from all over the world. And I think, my little token of advice from what distinguishes a strong observer from, a less strong one is a few things. One being how involved you are with, the team. And so, yes, you necessarily don't have access to the EMR, but as you're listening to us on rounds and we're presenting, if you, for example, we have a patient, we just had an observer on cardiology, and we had a patient with AFib with RVR who was admitted. And so they had failed multiple lines of, antiarrhythmic treatment and cardioversions. And so when the resident was presenting, we're kind of going over the overnight events and, what's acutely important. And at the end of his presentation, when we were done, talking about the patient, the observer brought up that they've been doing some reading on, if these patients have failed multiple lines of, first treatment, and they keep getting admitted with the same problem, they may be a candidate for, AV nodal ablation. And so he brought that up in a very, confident way that showed he did some reading. And, most importantly, he said, we should do this as an outpatient probably. Now, the reason that's so significant is because, a lot of, even me as a medical student, we're like, oh, let's do everything inpatient. But the way the system works here is a little different. So for an elective procedure like that, it would be done as an outpatient. So that not only showed that he was, reading up on his patient, on the patients, but also he had some system-based understanding of what was going on. And so at the end of the rotation, the staff asked me how he did, and I said, he was excellent. And the staff also agreed because for every patient, he would, write down what meds they were on, do some research. There was another example that we had a patient with peripheral artery disease, and we didn't know that, there's a new class 1 recommendation to start, rivaroxaban on these patients. And he did some reading on peripheral artery disease, even though the patient was admitted with heart failure, and brought this up. So, being actively involved, doing a lot of reading on the patients, looking up the most current guidelines, I think that will really make you stand out as an observer. The other thing that a lot of the senior residents have, complained about for observers is when, so if you don't have EMR access, and say you want to log on and, look through the patient chart, that's okay. And you can use one of our, access. But if, we're doing an admission or something, is acutely happening to a patient, that's not a good time to be like, hey, can you log me onto a computer? One, because then we can't access the computer. And two, because we're trying to think about, what to do for a certain individual. And then, when someone comes up, is like, hey, give me access, it rubs the residents the wrong way. And so when we give feedback to the staff, then we can share, oh, they weren't really understanding of, what was going on. Their situational awareness wasn't intact. So that's just a little bit of advice I wanted to give just because I've worked with observers. The next thing is your leadership roles. So being part of student organizations, academic committees. An example from here would be actually from my own father who went to Allama Iqbal Medical School. He started some poetry organization over there. And so he wrote that on his application. That shows a lot. That shows initiative. That shows, your interest outside of medicine as well. And it shows that you're involved with the student body. Now, QI or patient safety is the new big thing for every program. I'm sure whenever you interview with an APD, one of them will be involved with a lot of QI work. And so doing some QI work before entering into the match would be, phenomenal for your application. If you're a US medical student, if you can, do some QI project and present it at ACP, the regional ACP conferences have a pretty high acceptance rate, but that just shows, you're involved with QI, and your interview with that one person who does a lot of QI will all be about quality improvement. And then even in our program at CCF, for 2 years, we do a QI project with our frame, a group of people that we're assigned. So it's a big thing. And then organizing or founding educational initiatives. And don't need to say much about that, but creating research programs in your medical schools, creating like free clinics and stuff like that will all really show, will make you stand out. Now, teaching experience is huge. I know Dr. Unwer touched on this a little bit, but when you're a resident, when you're an intern, when you're a staff, even, your role a lot is teaching, your juniors, like the medical students, the interns, but also teaching patients themselves. So when we look at people's CVs, they really look into, what kind of experience have they had. For US students, in undergrad, a lot of us did tutoring. So throwing some tutoring on there would be great. Peer teaching. So if you're, in your fourth or fifth year of medical school and you're involved with, teaching anatomy to the first and second years, that looks really good. We have a resident in the clinic right now. She's from a medical school in Pakistan, and she was like kind of the head of the anatomy course at her medical school. Student mentorship, so putting down that you mentored so and so, and then teaching awards obviously are a great addition to your application. Now, community work. Community work is what your interview will mostly be about. And the reason I say that is they will ask you, what a population have you worked with that is outside of your comfort zone? So while it is great, especially, here in the US, we all are a part of our, Muslim free clinics. While that is a great exposure and experience to talk about, finding something else to work with a population you're not necessarily comfortable with. For example, if you go and volunteer at a church, those aren't the people you see every Friday at the mosque. And so putting that on your resume shows you're able to really work effectively, and you're able to talk to people outside of that look like you. And then awards for community work. There's a lot of awards that go around, especially at these free clinics. And so throwing those on there would be great. And then your research work. So I'll probably have Dr. Anwar talk a little bit more about research work, but for a resident, even a US medical student, I think almost every single resident in my class had some research. So that's to say that even for US students, research is important. Now, one or two projects will take that you had a meaningful involvement with will take you much farther than 60 projects that you were kind of one of the last authors on, and you just kind of helped at the end kind of tie everything together. And your role is what matters most. And they will ask you on the interview trail, what did you do for this project? And don't be ashamed or afraid to just say, I help with the writing aspect. I didn't come up with the clinical question. And if you do come up with the clinical question, that's great. But don't make that up, because if someone is doing some very, a CAR T therapy, research project, is it really you who brought up that idea, or was it your mentor? So be honest. And then empowering others in research. So it's great to throw on your kind of experiences that, in my research lab or my team, there were undergraduate students or medical students that were junior to me. And I helped kind of guide them through, the scientific process, how to do a systematic review. That just is another aspect to show teaching, and it shows that, you're interested in empowering others. And then your personal interests and hobbies. I think this is a very underlooked thing. especially when you're on the interview trail, people want to see that you're well-rounded, that you do something outside of just medicine. And so throwing on, that you're interested in, for example, sports or astronomy, you'll see that the interview, after their four, must questions they have to ask you, the rest of the interview will all be about, the, NFL or NBA or, soccer, whatever that may be. So those are all great things to throw on. And how programs evaluate applicants. So I have a lot of friends who are chief residents or previous chief residents. So I talk to them about, how do they evaluate or how does someone make the cut into being interviewed? So there's a screening process. So I know for the Cleveland Clinic, this year was a little tough. What I heard, I don't know how accurate this is, but the USMLE Step 2 cutoff was a 260 for IMGs, and for AMGs it was a little bit lower. So USMLE scores are very, very important. Red flags will instantly throw your application out. For example, if you have, any criminal record at all, that is, no matter what you have done, that really kind of throws your application out of the pool. Other red flags include gaps. So say, it took you 5 or 6 years to graduate medical school, an extra year, but you don't talk about why that was. Like, was it a family thing that came up, or, did you go do a research project for a year? So really not having any gaps in your application. And there is a filtering software that they use. And I wanted to just throw on social media content. While this may be more part of a holistic review, people do look you up. So they look up your Twitter, they look up you're on Facebook, Instagram, whatever that may be. So, making your accounts private would be advisable. I'm not going to go into what you should and should not post. I think everyone is mature and smart enough to realize what to post, but they will be looking at those things. So avoid, big controversial issues. And then and then comes your holistic program evaluations. And so here I want to talk a lot about your letters. So you will get letters from staff you have worked with. And some of these staff will ask you, why don't you write the letter for me and then I'll just kind of edit it and send it in. And then even if they don't do that, this is something to talk to them about. You really want examples in your letter. Instead of just saying he's a very compassionate individual who's very driven and very smart, you want to come up with examples. So an example will speak so much more than, them just saying that he is empathetic. For example, throwing on your letter that, this is just an example, you can come up with your own, but that you were in clinic and a patient came in who was considering pregnancy, and some of the medications she's on are not advisable to use during pregnancy. So what you did as a student or intern or whatever that may be, you went to the guidelines and printed out a table, for example, of medications that are okay to use in pregnancy for this condition. And then you went in the room with the staff and then you led like a shared decision-making conversation and showed them, the evidence and, what the recommendations are. So, you empowered that patient in that example. Not only that, you went outside of the box and you really tried to, help them or benefit them. Throwing an example like that on versus just saying you're empathetic will speak so much. Additionally, having your letters, mention that, this is the top 1% of students I've worked with. It actually matters. So throwing something like that on your letter recommendation would be great. Now comes to the next part, which I think is probably the most important, is your MSPE, so your program evaluations. I talked about this a little before. When you come from a US school, one of the biggest advantages you get over an international school is we have a very standardized process of evaluating medical students. And so when a program looks at that MSPE, they're able to really see, okay, they're good in this area, they're not good in this area. Versus when you come from outside, especially from a medical school that's not known, they don't know how to take what's written down. They don't know what, one, is it trustable? Two, like saying you're the best in this class, what does that really mean? So your MSPs are big, and working hard on your clerkship rotations is the best thing you can do. Sometimes your shelf scores may not turn out to be what you want them to be, but if your letter, the MSP doesn't talk about your shelf scores, it talks about how you are as a person, how you are as a medical student. So really kind of going above and beyond, doing presentations during rounds, like for 2 to 5 minutes on certain topics. All those get mentioned in your MSPE, and that's what the programs love to see. And then outside of that, they look through your experiences, and then the interview is where all your questions come up about what experiences you've had. And then I just wanted to talk a little bit about personal statement advice. So I've gotten several personal statements to help edit over the years. And so I think the most important point I can make today is do not just regurgitate your CV out. Do not just, list your CV in your personal statement. This is an opportunity for you to explain why you want to do a certain specialty. And, having an impactful story and having a theme in your personal statement is what's most important. Instead of just going down the list that, I did my undergrad in, cellular biology, then I went to, a research lab, then I went to medical school, then I went to a free clinic, like making that all tie in very beautifully into one single piece. Go through several edits. I know my personal statement went through 10 edits. Work with someone that's, has a big name, I would say. For example, I worked with the head of nephrology at the University of Arizona because they read all these personal statements, so they can give you better advice on how to change it than your friend, for example. But have people in and outside of medicine review it because it gives them you can add a more natural touch to your personal statement. And it is very important, especially for residency. I'm right now in the fellowship path, and so I've been talking to some mentors about, personal statements for fellowship, and they're like, for fellowship, it can't hurt you, it can only help you, but for residency, I know for sure it matters. I remember like during orientation of residency, the program director came up and talked to me about my personal statement. Absolutely have no spelling or grammar mistakes. That's a big red flag that can easily kind of disqualify your application. And then be cautious with AI. Everyone uses AI today. Just be careful with it. Don't make it too obvious that you used AI. For example, ChatGPT has like those three long dashes that it throws everywhere. Get rid of those. That's a easy uh, easy thing to look at to see, oh, ChatGPT wrote this. So just be cautious. AI can get to that to the end. But thank you, everyone. Thank you, Dr. Anwar, for everything.
Thank you, Ahmed. Wonderful talk. I think we will take the questions towards the end of today's session. And I think next up is Dr. Wright. Uh, I will hand it over to Dr. Wright.
I know, can you hear me? Loud a little bit. Can you guys hear?
Yes, we can hear you now. Yep.
Perfect. Okay. Thank you. Thank you so much. Thank you. So, first of all, thank you very much for having me. I am extremely grateful to Dr. Anwar and Dr. Raza for giving me this opportunity to share my experience with you and with everyone who has joined the webinar today. So basically, my presentation would be focusing on my own experience and match journey because I just applied for the previous match cycle and matched at the Cleveland Clinic for my internal medicine residency. So a bit about myself, my background. I was born and raised in Multan, Pakistan, and that is where I went to school, high school, and medical school. I went to Nishtar Medical University for medical school. I graduated from there in 2023. following which I came to Mayo Clinic in Arizona to do a 1 year of research position with a very, very good mentor. His name is Dr. Arbaz bin Riaz, and he's also a mentee of Dr. Faiz Anwar. So I did my research position with him for a year. It was in artificial intelligence and genitourinary oncology. And I applied for the match in that year, and I matched at the Cleveland Clinic. So without further delay, I would go to my presentation. Let me just share the screen. Uh,
Double click, yeah.
so can you see my screen?
Yes, we can see it.
Okay, so uh, okay, so this is a step-by-step guide about the match process. So I'll take it from there. So understanding the match process, basically the first thing that you need to know is about ERAS, what is ERAS and what is NRMP. So ERAS is the portal or application through which you will submit your CV to programs. That is the portal where you are going to upload your letters of recommendation. You are going to have your MSPE or Dean's letter. You will have your application, your profile, your personal statement. So everything that's related to your application is going to be through ERAS. And then once you apply to the programs and you interview at programs, and you get to rank programs, then that is going to be through the NRMP. So I just would like to mention that some programs do not participate in the rank through the NRMP and they are pre-match programs. So you just submit the application through ERAS and then they let you know if you've matched with them or not. But for most programs, you will first submit your application through ERAS and then through the NRMP, you would be ranking your rank order list according to the programs where you want to go. And then the algorithm works itself and you match where you match. So briefly, I will also touch on the timeline and what the timeline looks like for everyone as well as for IMGs. So there are two parts to the timeline. So the first part is you working on your ERAS application, and the second part is when you interact with the NRMP to rank your programs. So this timeline I've taken from the 2026 match timeline. So whatever dates I mentioned here are going to be applicable to the coming match. So it would be good to make a note of these, or otherwise you can always go on Google and you can type in like timeline for the match 2026 and you will get all the dates which are important. So the first important date is June 25, and it's just in 4 days. And that is when the ERAS token will become available. So what happens is basically you go onto your ECFMG Oasis and you go and get the ERAS token from there. And then you take this token and you go to AAMC, the website, and you start your ERAS application. But before you start the application, they ask you for the token, and that's going to come from the ECFMG Oasis, and it has a fee. I think it's around $160. So in June 25, the ERAS token will become available. You will get the token from there. You will make your My ERAS application in the AMC, and you will start working on your ERAS application. And again, as I mentioned, there are several portions to the ERAS application. The talk today would not focus on the portions of the ERAS application, but I would just briefly mention what they are. Again, they're just letters of recommendation, your personal statement, your personal information. They ask you a little bit about information as well, about you, about your medical school, and then it's going to have the option for you to list all of your programs where you want to apply, where you want to send your ERAS application to, and you can list all of them. And then you can choose to assign your application to them and assign your letters of recommendation to them and assign your personal statement to them. So And this is all going to happen in your MyRAS application, and the token will become available on June 25. Following this, I have not mentioned a few dates in between. These are just like the most important dates which you absolutely cannot miss, but please like go through all of the dates at your own time. So September 24 is the deadline for application submission. So what happens is that around September 3, you can begin to submit your ERAS application. So between June 25 and September 3 is your time period to work on your application. And then between September 3 to September 24, you can choose to submit your application anytime. September 24 is the deadline, and I basically submitted it on that day, like which was the deadline. I don't recommend it. So make sure that you have everything in place. So the most important thing with the dates is you need to make sure that you have everything in place before September 24. So on September 24, you apply to the programs, you assign them your letters, you assign them your personal statement, and the programs will then begin downloading your application after September 25. So don't miss this date. And then what happens is between September 25 and January 30, you will have submitted your application to programs. They will be sending you interview invites. You will be interviewing with them, and that actually continues all the way to February. And then around March, this is also the deadline. So there's a date before this deadline when it opens up, but March 4 is going to be your certification deadline. So you will be interviewing at programs between October, November, December, January, and maybe February. I had like one interview in February, otherwise, mostly the interviews end by January. And then on March 4, you will submit your rank order list, which is going to be the list of the programs which you will rank starting from like your top choice all the way to your bottom choice from the interviews that you had. So for example, if someone had 8 interviews, they're going to rank the 8 programs 1 to 8 in the NRMP website, and that is going to be their rank order list. And the deadline for the rank order list is March 4. And then there's another date before March 20, but March 20 is basically you find out where you have matched. So there's a date before March, I think it's March 16, when you find out if you have matched or not. And I would just briefly mention that between March 16 and March 20 is the SOAP, which is where all the unfilled programs will become available, and you will be able to apply to the unfilled if you went unmatched. So you can apply to the unfilled programs, and then March 20 is going to be the match day where you find out where you have matched. So very briefly, June 25, ERAS token, September 24 is deadline for application submission, and then March 4 is rank order list certification deadline, and then March 20 is match day. Okay, so then I'll briefly touch on the ECFMG certification. So this is very important for IMGs, and it's very important if you want to apply for the match. Technically, you can apply without it, but I would definitely not recommend it. Absolutely be ECFMG certified before you apply. So the minimum criteria, ECFMG certification, you need USMLE step 1, you need your USMLE step 2, you need your pathway application approval. So what happened is that before pathways, there used to be step 2CS. So there was step 1, step 2 CK, which was the clinical knowledge, and then step 2 CS. But then there was COVID, and we stopped having step 2 CS exams. Now we only have like step 1 and 2. So the CS portion was replaced with your pathway application. So ECFMG actually opened up like 6 pathways. So you have 6 pathways through which you can become ECFMG certified. And all of the pathways require your OAT exam. So here I would just like to briefly mention that there is a deadline for the OAT. It is not the same as PLAB. Some people think that OAT is valid for 2 years and they take it. For example, they may take it in June of 2023, and now it's 2025, and they think that the OAT is still valid. But that is not how it works for the pathway application. So for the match of 2026, if the OAT exam was taken on or after January 1, 2024, it will be considered valid. If you took it in 2023, it would not be valid for the match of 2026. So, uh, so you need your step 1, 2, you need your pathway application and OAT. So for the pathways, there are 6 pathways, 1 to 6. The pathway 1 requires you to have a license to practice in the US, and that basically, if you have done your house job and you have your permanent license, for example, for Pakistan, then you can apply through pathway 1. If not, for example, I applied through pathway 2. Now the same students from my medical school are applying through pathway 3. And if you don't if you don't fulfill the criteria of any of the pathways 1 to 5, then you can apply through pathway 6. So you can read more about the pathway application on the ECFMG website, but generally 1 is if you have a license, 2 is if you graduated like really early. So when I applied, we were not WFME accredited, so I had to do pathway 2. But now many medical schools are WFME accredited in Pakistan, so it's pathway 3 for us. If none of this is making sense, just you can just go to the pathway application and put in your details. They will guide you step by step, and they will tell you which pathway is applicable for you. And then pathway 6, again, if you don't qualify for any of the above pathways, then 6 is like you have to give a small exam, and your preceptors or doctors who are going to assess you are going to send the assessment to the ECFMG, and then you will be cleared for pathway 6 as well. So for the pathway application, usually it opens in May every year, but this time I think it's going to open in August, so you can check on that as well. This is extremely important because you need it to become ECFMG certified, and I think it would be good to have step 1, 2, pathway and OET done uh, at least till August, so that you have your ECFMG certification in September when you apply for the match. Okay, so now I would like to discuss about how we can build a competitive profile, and I would also share my experience of matching at Cleveland Clinic. Uh, Definitely first, as Dr. Safdar has also mentioned, that step 2 score is very important. It's extremely important. I cannot emphasize this enough. And you should definitely try to score as high as you can. This is not like applicable to step 3. So step 3, I would say that definitely try to take it before September, and try to score as high as you can. But it's really like the step 2 score is really the most important one. When I applied, I did not have step 3. I only had my step 2 score. It was in the 260s, and um, I just had my I was ECFMG certified, and I just had my step 2 score then. But I would highly recommend, if you can take step 3 before September, you should take it. I think I did not get a few of the interviews just because I did not have step 3 in my application. So I think it's really helpful to have both step 2 and step 3 when you apply, but definitely try to score as high as possible on step 2. The second, again, as Dr. Safdar has mentioned, having US clinical experience, and here I agree with him. Definitely electives are better than observerships, but if you were not able to do electives, then observerships are good to go. So my experience in this regard, I did my own elective at the Cleveland Clinic. In my final year of medical school, I rotated in the Department of Cardiology for 1 month, and with 4 attending, so it was 1 week each, because I was here in December in the Christmas time, and it was just a 1 week rotation with each attending. And here I would tie in the letters of recommendation. I got 4 letters of recommendation. So I I've been asked this question like multiple times, how was I able to get 4 letters in just 1 month? Because I've seen people struggling to get even 1 letter in 1 month. And I think it's all of the things that Dr. Safdar has mentioned, how you need to be on your rotations so that your attendings write you a letter. 3 of my attendings were very nice. They just agreed to write me a letter like right away, and one of them told me that he did not know me well enough, so I had to perform good, like everything that Dr. Safdar has mentioned, like reading up on your patient, asking like insightful questions. Um, and one of my attending was really he really liked physiology, and I had gold medal in physiology from medical school, and I was really good at it, so I was able to uh, really connect with him over some physiological principles, and that's how he gave me the letter. And with the letter of recommendation, you really want it to be strong and personalized. So having a generic letter versus having a strong and personalized letter, I think the strong letter is always going to work in your favor. Generic letters may go against you. It's always good to have like strong and personalized if you can. Definitely have strong and personalized letters. With electives, you have the opportunity to present patients and interact directly with them. Like you almost like can act like a resident because you have access to the EMR. I used to write my own notes, and then the attending would sign my notes or add an addendum. And in observership, you do not get that hands-on experience. So definitely the letter that you'll get from the elective is going to be better than the letter you can get from the observerships. But general principles, they apply to both. Be punctual, like being uh, reaching there early before everyone else, and um, being the last one to leave. So that those were some of the things that I was doing, and then reading up on the patients and discussing them with the attending. And I really had good physical exam skills. Many of my attendings gave this feedback to me that my physical exam skills were above the average US medical student, and they also really like my clinical knowledge as a whole. And so just if you're just professional and you are there on time, and you are uh, putting in the effort to read up the patient, and if you're on an elective, then presenting the patient, so it really helps getting a good letter of recommendation from your attending. Year of graduation, I have written it as less than 5, but I think it's better to have less than 3. I don't want to discourage anyone who has like a high, everybody, like I know people who have more than 5 years of graduation who have matched. So, but I would just, because we're talking about a competitive CV, my year of graduation was a 1 when I applied for the match, and this was also my first match cycle. But generally, I think it's good if your year of graduation is less than 5, and it's better if it's less than 3. But this is a non-modifiable factor, so I understand. I think it's good to work on the other things if you can't work on the year of graduation, but it's good to apply like right out of med school and to have as few gaps on your CV as Dr. Safdar also mentioned. Then research and publications, having abstracts, posters, and full text. Here, I probably did not like have a lot of research in my profile, but because I was doing a postdoc position at Mayo Clinic in artificial intelligence, I was learning about Python and R and coding, and how we can improve AI models for research purposes and for improving patient care, and then also working on some retrospective studies with genitourinary oncology. So I think like doing a postdoc helped me here, but I think generally here having at least some amount of research is good. Having this blank is not that good. So I would say try to have some abstract, some poster, some full text, or you don't have to be, it's good to be the first author, but if if you're not the first author, for example, then just try to collaborate with other people so that you are able to write something for research and publications. And then volunteer extracurricular, again, as Dr. Safdar has mentioned, this is also extremely important part of the application, and I think we as IMGs like kind of neglect this part. But having a mix of each of these experiences in your 10 ERAS experiences is really helpful. So in the ERAS CV, apart from your like uh, personal information and your letters and your personal statement. Apart from all of that, you can add up to 10 experiences, and you can choose the category for the experience. So if it was a volunteer experience, you can put them as a volunteer. If it was an extracurricular, if it was a leadership experience, if it was a teaching experience. So I had a good mix. I was really involved in medical school and in a lot of things, and even for my interview at the Cleveland clinic, they were really interested in knowing about my leadership experience and my and many of my other interviews. They asked about my volunteer experiences. So I basically used to do blood donation camps for thalassemia patients in collaboration with the Indus Hospital at Nishtar. I I organized a very big movement for women's rights in Multan, which is my hometown. And for the extracurricular, I was captain of the cricket team. I was playing table tennis, and uh, yeah, so I actually had a good mix of everything, and that I think really helped. And for teaching experiences, I had been teaching my peers for 3 years. During COVID, we also made like free teaching sessions, and I was able to like list all of my experiences like that in almost each of the categories which were given, and that was like a good mix of each of the ERAS experience. And then we have honors and awards. So I graduated top 5 of my class in medical school of 330. I had um, 2 gold medals in MBBS. One was in physiology, one was in OBGYN, and I had 6 distinctions. So I was able to. So this is also a part of your ERAS application where you can list if you have any honors and awards. So I was able to list my table tennis championships. There was a physiology quiz which was all Pakistan and international. We ranked second in that. There was like all of my gold medals and my distinctions from MBBS. I was able to list all of those in my honors and awards. So as a whole, like my CV was pretty wholesome, and except for step 3, I think it was pretty much covering and touching upon everything. And as Dr. Anwar also mentioned, that we have there's also some significance given to the medical school. So no one from my medical school matched at Cleveland Clinic. I think that was maybe where I might lose some points, but otherwise, as a whole, I made sure that my CV was up to the mark. And very quickly, I would just go over the common mistakes that you should avoid before you apply for the match. And the first is definitely don't apply late. So as IMGs, if the program starts to download your application on 24 September and you're not ready with your application, or if you have an incomplete application, and they already downloaded the application that they're going to review, yours got already screened out. So definitely apply before the deadline in September. People have applied late and still gotten interviews, but I would highly recommend to apply before September 24, and that is the deadline. So please keep that date in mind. And then this mistake I made myself as well. I did not research programs very thoroughly. I actually was on my research position and I was working full time, and uh, I unfortunately could not find that much time to like research all of the programs. But if you research all of the programs really well, you can do really well in terms of which programs you should apply to and which programs you should signal. Signaling played an extremely important role in the previous math cycle, so definitely be very careful where you signal, especially your gold signals. You will have 3 gold signals and you will have 12 silver signals, and the signals you will assign when you submit your application. So again, we circle back to the same thing about the ERAS application and why it is important to have everything ready when you apply and, and know where you are going to signal. So I was very wise with my gold signals and I got 3 interviews from there, and not very wise with my silver signals and I only got one. And I've known people who really use signaling very well, and they were able to get like 8 and 9 interviews out of their signal programs. So the way you research programs is that you go onto the website, and this you should really start now if you haven't started yet, because it takes a lot of time. You go onto the website and you read the criteria, but sometimes programs may mention something on their website and not really follow it to the dot. So it's good to reach out to the residents and just like ask them if you would be meeting a criteria for them. For me, since I had like a year of graduation of one, my score was in 260s. I did not. I thought I might not be getting filtered out, so I applied very broadly. But it's definitely good to research programs. So you don't need to apply to 200 programs. You can really narrow your list if you know exactly which program criteria you are meeting and targeting specific programs and signaling them as well. And then this is extremely important. I cannot emphasize your interview prep enough. I know someone with 14 interviews who went unmatched, and probably when you have that much interviews, definitely there's no problem with your CV. Probably your interview did not go that well, and it's I think it's really sad to know that 14 programs did not rank you. So definitely give as many mock interviews as you can, practice with your peers, seniors, and friends, and get their feedback and try to improve, because in the interview they're going to assess your communication skills. And that is important because as I think Dr. Safdar mentioned and Dr. Anwar mentioned that if you cannot communicate properly, then the program will have this reservation how you will communicate with the patients. So this is extremely important to prepare for your interviews well. And instead of having a generic personal statement like me, I think it would be good for you to personalize your personal statement, like at least write two versions, one for community programs and one for academic programs, and then try to like personalize the last paragraph for your goal signal programs. So that would be your three top choices. So in the last paragraph of your personal statement, you can just write something specific to those programs and assign those programs with your personal statement. And then not networking is a huge point. I think you need to reach out to people as early as possible. So basically, the next match starts as soon as the previous one ends, and people start reaching out right then. Uh, so the thing with networking is you may have an excellent CV, but it may not be getting reviewed. So networking, it just helps you to make sure that at least they reviewed your CV, and it's good to like reach out as early as possible. And finally, as Dr. Safdar mentioned, having like grammar or spelling mistakes in your PS or ERAS is a big no, because you are supposed to be communicating with patients in English, and then if you have like major red flags in your ERA, CV, and PS in terms of how you've written it and the mistakes that you've made, it really looks really bad. So thank you very much. I tried to wrap up as as quickly as I could, and I can take questions at the end. Uh, and I think I'll hand over to Dr. Anwar now.
Thank you, Dr. Reich. Wonderful presentation. You covered a lot. I think that was very helpful. Um, before we take question and answer, I would like to invite Dr. Raza. Dr. Raza is our Education and CME chair at our chapter. He's an associate professor at Cleveland Clinic. He's a hematologist oncologist at the Cleveland Clinic, and has been involved in mentoring medical students for a long time, and has been doing these webinars. So I would really like to hear a few words from him, a few pearls of wisdom, as I may call them. So I know Dr. Raza is in the room with Dr. Wright, so we'll wait for you. And again, I think a lot of questions have come up in the chat. We are trying to answer some of them in the chat. So please keep an eye on the chat as well. And if you have other questions, feel free to put them in the chat. So with that, I'll have Dr. Raza take over. Thank you.
Sorry, we are running out of time, and we don't have much time. I will just take 5 minutes here. So my job is to, this is an excellent presentation. I am very impressed the way Dr. Safdar and Dr. Varaich has go over the things, the two different perspective for the US grads and international grads. I'm very impressed by myself too, like learn a lot how the system has been working and how things have been changing. I will not go to the details because she covered a lot of things for us, but I'm just going to show you some data that we have, that what makes you a successive, how you can get success from this process. Like, I think it's very important to know that, and it has to be personalized, each of you, because everybody has a talent. Everybody has something secret sauce or something unique. So you need to explore that particular thing. So without delaying it, I just want to tell you my little journey here. So if you look at it, let me just pull it up here. Okay, I think she covered it. So see, I started like you. I was just a research scientist initially for 2 years, spending time in the research. But that helps me during my residency training because I was the chief resident. And they always mention, oh, you have done a lot of research. That helped me as a chief fellow because they again told me, you have done a lot of research. You can mentor our students, and medical school students, residents, and fellows. Then they put me in a medical medical education committee. So I start recruiting residents for the program. Then they put me in a fellowship rank order committee. And then this is how you progress in life. And I think where it is very important, this comes in a ladder pattern. You have to go one step up and up every year. Look at yourself, how you can improve. Now, if you look at it here, so look at it, how competitive things are getting. Everybody has a talent. The slots are not everybody can get the residency training. Every year there are some people who are unmatched. So it's very important that you personalize your approach and see how you can get matched and how you become successful. So in this first webinar of the week 1, we're not going to go to details how you can improve yourself. Yes, you got a lot of tips here and a lot of ideas, and you have an idea. I just want to show you some data. So look at it. This I took it from NRMP website. This is for American grads. For example, they're going for general surgeries, and they particularly look at it, that how many have done research and what is the data looks like it. And you can see that the people who do the research, they have a higher chances to get matched, even in general surgery. So you can see
Dr.
the
Raza,
yes.
I'm sorry. I think some of the people are not able to see your slides, so
See
they're
now?
in the chat. So I just want to make sure that we
Okay.
I can see your slides. I'm not sure. Okay.
Can they?
Uh,
No. How about this?
I think it looks like they can see your slides now.
Okay.
Can
This one.
somebody, Dr. Anwar, can you tell us if you can see his slides?
Well, let's see. Can you guys see it?
Yeah, I was able to see it now.
Okay, wonderful, wonderful. Not much change, but same thing. This is just showing that how general surgery, you can see that even the general surgery, your research does matters a lot, even for the US graduates. You can see the more you do research, the better your chances will be getting it matched. Same thing, you look at the other area, for example, when we try to look at in American grads, like how the scores matters, even if you can see in internal medicine, the probability of getting matched does increase if your scores are higher. Now we have, even you can see how nicely this has been. It will help our students to understand that how much scores do correlate with the success in getting it matched. Again, this is another slide. You can see the probability does increase getting into the match. Now here I'm going to show you for internal medicine. Let me show you here. Sorry. So here I can show you the internal medicine for US MD seniors. Now you can see that this research experiences even in medicine also counts a lot. Those who do research, they have a better chances to get match. Same thing for an abstracts, 1, 2, 3, 4. The more you do, the better would be the outcome. And similarly, the work experience wise, you don't have to be the whole CV is full of your work experiences, but if you have a good experiences for your CV, that really helps a lot and provides you better letters of recommendation, and it shows your commitment that you're very much in it and you want to be successful and you are a hard worker. So I really like people to show their experiences in their CV that they have volunteer work experiences. Now, this slides, I just want to show some people this is relevant. For someone, this is not relevant. For example, interventional radiology, there is always an ambition people wants to do. I think before you apply, you really have to look at it. Are you fit for this specialty? Have you done the workup for that? So you can see for this one, even in interventional radiology, how much it costs, like experiences, the research experiences. But even if you look at it, 5 or more research experiences, is still there were 9 people who are unmatched. And if they have applicants who are unmatched, then you have to look at it, why they become unmatched. And then you have other factors, letters, experience, all these things count. So, but this will provide you enough data. Now I'm going to switch the gear here just to show you in 2 minutes the international medical graduates thing. Now here you can see IMGs. We typically tell them, okay, internal medicine is good, psychiatry is good, neurology is good. You can apply and whatever you want to do, I think you have to just look into that. Is it good field? It is a good fit for you or not. Now here you can see that IMGs do apply in other fields too, but the ratios and getting it to match the probability is different among each specialty. In internal medicine, there is a 0.5. This is a significant for non-US IMGs and compared to all other applicants. So I do feel that you really have to pick and choose what specialty is good for you and what your experiences are telling you. Now here, similar data in a different format showing the IMGs in different US and international graduates and versus the US citizens, how their specialties vary. But you can see the proportion bar for medicine is much higher for international medical graduates. Now, again, anesthesiology, same thing, and scores does matters a lot. And you can see the higher the score, the better are the chances of getting into match. Now, same thing for the family medicine. I think for the family medicine, I strongly feel that the score is a very important tool. And you can see many people put family medicine as a backup specialty. What I have learned from, unless you really want to do it, those who really want to do, they will get it. But those who put it as a backup specialty, they really have to look at it, what makes them unique, what makes them different. Again, scores with the different ranges, then you can see success here and misses. You can easily see here who match, who don't match, but it is it's still, I would say the score is very important here. The higher the score, the better it is. Now, research does count, every field, every specialty. You know, sometimes people, this question come up, how much research we need to do. You don't have, as Dr. Varai mentioned, you don't have to be just your CV full of research. Then we really need to know whether you're a good clinician. I think you have to have a balanced portfolio, a well-balanced portfolio, which tells your story, because you are going for clinical job. You're going for taking care of patients. That's your job is. So you really have to be good in clinical. Then whatever helps your clinical skills, that comes next. Your research, your volunteer experiences, your leadership qualities, those things actually count them. Here you can see that how the research of experiences do count. And probability does increases, but it's not necessary for family medicine because this is more a clinical field. But I strongly still recommend that if you really want to be successful, have to have some experiences. Now, in the end, couple of things, and this question, maybe you have it in a chat, but I do not know yet the questions and don't know we have much time. Advanced degrees. So some people do struggle with their portfolio. They do not have much to share that, and something happened, exam didn't go well, the bad experiences happen in medical school. If you're persistent, I think you can get it. I just feel that you have to find the way. And one of the things we really like advanced degrees, MPH, PhD, and something extra that you have done it, because programs are looking for X factor. And it's Dr. Varaich has some X factor, Ahmed has some X factor. You can have that X factor too. You just have to explore that. That X factor is important. You can see here how much advanced degrees does help students to get into the residency program. With that, I'm gonna stop the presentation because we guys have some questions and we need to get those questions. This is the last slide just showing for IMGs, internal medicine. Scores do matters a lot. And you know, the better the score you get, the more other chances are. You can easily see that even between the IMGs, those who are US IMG versus the non-US IMGs, you can see that you need a higher score more for the non-US IMGs. But again, this is one piece of the puzzle, like, the scores with addition, you need something else. With that, I'm going to stop my presentation. I'll give the mic to Dr. Taj and Dr. Anwar.
Okay, thank you so much, Dr. Raza, Dr. Safdar, and Dr. Baraich, and of course, Dr. Anwar. I think we will take questions here from the chat. I'm gonna. I think there were some of the questions that were answered in the chat. We will, if time permitting, go back to them while we're discussing here. So there's one question here says, I guess, Dr. Raza, if you want to take that. In terms of research, is there a preference towards certain types or research topics over others?
Yeah, that's a good question. So I think Dr. Anwar can also weigh on that, and he's been doing tremendous job for the young graduates for many, many years. I think there are ways you can involve. We can start with the case reports, case series, review articles, making a team in a collaborative efforts and publish them, learning the art and skills, how to conduct the meta-analysis, how to conduct the large data sets. I think these are very, very important things that we really like to see in the students to learn these things, because sometimes when people do research, they think it means the lab research. You just have to be in a lab and work with that, or you need a data from the patient's care. But it's hard sometimes while you are in the training different institutions, but you can be a part of the team, part of the group, part of the people where people can benefit from your skills, and you can benefit them and they can benefit from you. And this comes by learning some skills and learning how to write, how to publish, join the group of people who are working on it, how to conduct the review articles, how to learn the studies, how to learn the stats, maybe biostats, meta-analysis, how to review the data. These are all important things, and it comes from you. Once you are ready for that, I think the mentor whom you're working with, they can help you with the projects. I know, Dr. Anwar, you want to add something? Feel free to add.
Oh, thank you. Number one, I think it's now 12:12, so we are already past the hour. I think that beyond even my expectation, Ahmed and Dr. Waraish did a fantastic job. And Dr. Raza, your slides, your insight was really great. Now, many a times we get some questions, now I'm done with the steps and now I'm ready for doing research. Give me a topic and I want to do research. That's not how it works. Number one, when is the time to do the research? And it takes me 6 months to a year to publish anything. It could be a small piece, but literally it takes us a year to publish. By the time you submit, reviewers review it, they send it back, you send it back, it's a year. So if this is June and now you're done with your step 2 and you're studying step 3 and part-time want to do research, you're already 3 years late. So for the group which is applying this year, that may not help, but people who want to plan ahead, you should be studying and you should be doing all these things in the first year of your medical school, in the second year of your medical school, in the third year of your medical school. And I know, they keep you busy with your curriculum, but, being young with so many resources now available at your tips, do not waste time here and there on a social media. This is your time to be ready, develop that excellence so you can serve better. But so you have to take time. Then start reading. If you want to do research, you cannot just imagine it. So you start reading papers which are already published. Zoom on a topic which interests you more. And once you read 10 papers, 20 papers, 30 papers, your mind will open up. You will have a baseline knowledge. And then you start writing small pieces here and there and start with an image report, start with a case report. and then start with maybe an educational review. And that's where you will get an attention of a mentor, which could be local, national, or international. So it's a process. I know there are some questions in our chat. Let me take
Doctor,
one question. There was a question about
Dr. Anwar,
Uh-huh.
I'm sorry to interrupt. So, Dr. Khan, our president of our chapter, he's a pediatric cardiologist and a professor here at Akron Children's Hospital. He's on the chat. I would like to give him a few minutes to discuss his experience and his insights as well. So, with that, with your permission, Dr. Anwar, I'll just hand it over to him for a few minutes. Dr. Khan?
Assalamu alaikum, everybody. Can you guys hear me?
Yes.
Okay, so I mean, I agree a lot of the things that we have discussed in this forum at this point. But as Dr. Faiz Anwar said that, like residents, they have to do that, they have to work hard to achieve things. I mean, many times I hear from IMGs that, we need to develop connection. Connections are important, but they're not the only thing. You have to work hard. I mean, you have to show your interest, your enthusiasm, and go from there. Do not expect that the things would come to you. You have to work for the things to get to the point. So my message is that you have to work hard, and we know that you are working hard. I was in a IMG too, and I couldn't get matched 30 years ago on my first match, but I didn't lose hope, and I was one of very few people who got into a January program. So they do have in New York and big cities, sometimes they do have January program that if you don't get matched into, you just keep on looking for positions. And I got into the January program. I don't know whether they have it anymore or not. But the bottom line is that you have to work hard. I mean, you cannot just say that, oh, my so and so connection is there and they will get me into the residency. That's not how it really works in ideal world. So that is my message. Thank you.
Thank you, Dr. Khan. All right. With that, I think Dr. Anwar was about to take some questions. I'll take one question from the chat here. The question is, if we are asked about our low scores, how should we respond, provided we do not wish to go down a ramble of trying to make excuses, etc.? Is there any correct way to go about this? Dr. Anwar, anybody? Let me unmute here. Start with Dr. Anwar, see if you have a few words here.
Okay, great. Thank you. Yeah, no, I think, a low score can be there and it could be multiple reasons. Just recognize it and be genuine and open about it. But what's more important, since that low score, what you have done to neutralize that red flag, I think that will be more important. The score probably was low, that was a year ago, but you can say that since I have studied more, I worked in the clinic, I have done more teaching experiences, I have published more. So just to let them know, give them a reason that they should forget the red flag. And how did you overcome? Let me see if Ahmed wants to make a comment about that as well. Thank you.
Yeah, I think that's a great question. I think one thing to note, and this may be a little too much insight into like how CCF evaluates applicants, but so one thing I forgot to mention is Dr. Anwar touched on in the beginning. There's a score system. So for USMLE, you get a score. So say you're from 240 to 250, you can get 1 point. From 250 to 260, you get 2 points, and above that, you get 3 points. I think the max is 3 points you can get. And then everything is scored. So say, you don't have the score that you want and you get low points on that, well, other things in your application can really make up for this. And I think that's really important to recognize. So how many research publications you have can add up to points. You know, how strong your LORs are can add up to points, and your other experiences. So yes, it's important, but it's only one part of the application. And if you can really show other ways, you can stand out. And I think from being a resident and with interns who have all sorts of scores, the score doesn't necessarily reflect how good of a clinician you end up becoming. And so that's just another thing to remember. And then, like Dr. Anwar said, yes, you recognize it. And like the comment even said itself, don't babble on about it and be like, you know, unfortunately, this didn't end up the way I wanted. And people do have bad days. So say you have a low step 2 score, but on step 3, you really worked extra hard and you outshined. So you can always make the argue. I mean, you don't have to make an argument, but people recognize, oh, he may have just had not the best day on that day, but overall he's very competitive. So I hope that helps and answers the question.
I would like to add one very important thing. One of the things what we see, the candidates are applying every year, and they're not selecting the right specialty. I know it's competitive. Step 1 doesn't have much score anymore. I mean, this is now only for step 2, and then what you have done it in the slides that I show you. I also mentioned that you have to make your work on your resume, PhD, masters, MPH, something extra that you can tell them, because there are many candidates. They're applying it for one slot, and you have 20 candidates. Why they will take somebody who has lowest score? They unfortunately, this is the only criteria they can use it to screen your application. But if you want to be shine, you have something extra, and maybe masters, additional study, what Dr. Anwar and Dr. Ahmed was mentioning, which is 100% correct. But one thing I would like to mention, that sometimes you have to compromise on your dreams, which I'm saying very respectfully, but it is something is important. If you are struggling and you're not getting match and you're applying for competitive specialty, for example, if your scores are in early 200 range, 210 or 20, and you're applying for radiology, general surgery, I think this is difficult. And you keep applying it, it's not going to happen easily, unless depends on the other circumstances, the situations. But the odds are low. Even though you work hard, you make your CV excellent. I know many examples where the candidates have low scores, but they spend years and years in research because they want to be in that field, and they were successful. So it can happen, but the pathway could be very bumpy and sometimes very, very difficult. So you have to be wise what you choose, how you select, and make your CV in that direction. One of the things what I see, that backup specialty, people wants to be psychiatrist because they're not matching it in internal medicine. I feel bad to say, like, this is not the way this field works. And our psychiatrists are very smart. They know from your personal statements what you want to do and pick it up. So if you really want to change your career to the psychiatry, neurology, you have to make your CV in that direction. So it's a tough answer to say, okay, one field is better, but you have to be sometimes very wise what you choose and what specialty you select.
I will, I'm a psychiatrist here at University Hospital, so I'll just follow up with that. I think in psychiatry, a psychiatrist and the programs do realize people who are applying to IMGs, especially who are applying to psychiatry as a backup and might not have the aptitude for the field, get burnt out very quickly in the field because it is different. So it might not be as competitive, but they've had people who did not do as well, or were not as focused in the field. So they do not want to have somebody who's not really invested in the field. So sometimes it's useful and could be very meaningful to reassess your priorities depending on what your strengths are, and trying to see if you can enter the match and go forward according to what your strengths are, not to highlight your weaknesses, but to highlight your strengths. Also, I mean, I think it's also important that if you're if you did not score well, if your scores are not as high, to not go towards making excuses, but to have a responsible answer, explanation somewhere in your personal statement to cover that. You know, it shows some resilience and some grit that you're able to take responsibility of something that might not be as competitive, but then you have to show in your CV and statement what else makes you stand out despite that low score that you have. There are different ways to do it. We can cover it in our following sessions in some ways. But if the other point I wanted to make, that if you've already secured an interview at a program, you have to realize that you've already passed that screening of scores. So they actually have given you an interview. There are very limited spots for interview, and if they're interviewing you, they are okay with your scores. They just want to know how and what you've learned from that, and if somebody's actually asking you during the interview. So those are some of the thoughts that I had. With that, let's see if we have another question here that we can take. Okay, so how would your personal statement differ from for university versus community programs? I think we're covering personal statements in our next part, so we'll defer that for our next session. Is it okay to tell them your bad experience? Like, I never thought of USMLE, but after completing my house job, I had bad experience and wanted to move out. I think if you're asking about interview, we'll cover that a little bit more in detail in our part 3. So we'll defer that in interest of time. Okay, let me see. Should we mention unpublished research projects in CV? I will give that question to Dr. Varaj.
So for the ERA CV, you have the option to mention if something is submitted but not yet published. If it's published, you can put it under published. If it's submitted, you can put it under submitted. But it's not, if it's like not submitted and not published, then you will not be able to write it there. But if you really want to mention it, then maybe you can mention it in your top 10 experiences in the ERAs that you were working on research, and this is the project that you're working on. For example, I had a paper which was not submitted or published, so I was able to mention it in my top 10 experiences. And if it was submitted or published, I would mention it under the research section. I hope that answers your question.
Okay, thank you. We can take 1 or 2 other questions here before we end in a couple of minutes. Let me see. Okay. Any other questions from the participants as I'm scrolling back to see if there's any other questions that we can take? I think we've covered most of the questions. If there's any other questions, please feel free. We have 1 or 2 minutes. And then we'll wrap up. Okay, here's a question. It says, where can we mention poster presentations? So again, Dr.
Yeah.
Go ahead, Dr. Baraj.
In your ERAS application, you have a section for research and publication, and you can put it under abstract or like full text or like poster. So you will have those options there. So just as soon as like on June 25 when you get the token, just take your time to go onto the application and go through all of the sections, and you'll know that where something will fit in.
Another question here, I think it's is it essential to do both electives and postdoc research fellowship to get matched in surgery? I would just wanted to say that in our subsequent sessions next week, and especially in part 3, we will have surgery faculty on our panel, so they can answer more specifically about surgery specialty. But postdoc is something that will obviously help. The necessity of it, we'll have to defer it to a surgery faculty who can give you a more specific answer.
Yeah, I just want to add, I show you the slides that you can see the research publications. The more you have, the better the surgical match happens, and depends on the position. What position are you getting, and what are you getting, and experience from that position. Unique experiences, innovative experiences, they all count. Now, surgeons can tell you more, but if you ask as just a regular doctor's perspective, I strongly feel it is something that I would strongly consider, but it adds value to my CV. It's not, it's a unique experiences, and everybody's looking for something extra in you. So that X factor, sometimes you get X factor through these positions.
All right, it's almost half an hour past the hour. So with your permission, Dr. Taj, I think we can conclude the session. And I want to conclude by saying each one of you have an X factor. And we recognize that. We thank you for that. Thank you for your hard work. Thank you for your passion. Thank you for your sacrifices. Where you are today was not easy without the sacrifices and hard work and talent. So many thanks to you, many thanks to your family, many thanks to your teacher, many thanks to your mentors. And what we are now trying to do is go to the next level and continue to grow, get better, and so we can continue to serve humanity in a better way. Thank you so much.
Thank you.
All right, thank you. We'll see you next week.
Inshallah.